Vasavi Vidyalaya are here to give you a recap about hepatitis on World Hepatitis Day. Me and my colleagues made a short video trying to express our duty as science students and make our friends aware about how well we fought with hepatitis and won the match against it. Now, in entering to hepatitis is an inflammation of the liver. There are 5 types of hepatitis viruses referred to as A, B, C, D and E. It is a deadly disease. Hepatitis is a chronic disease in hundreds and common cause of liver cancer. Thank you.
Mild to severe illness. Hepatitis A is transmitted through contaminated food or water or through direct contact with the infected person. Although whoever is suffering from hepatitis A could recover through lifelong immunity, however, there are a small proportion of people who could die from fulminant hepatitis. Risk factors include lack of good water supply, poor sanitation, poor hygiene. There are many methods to tackle this disease. One method is to administer the vaccine at a very young age to prevent this disease. Symptoms range from mild to severe. Some symptoms include fever, nausea, bloating, abdominal pain, and jaundice.
Hepatitis B. Hepatitis B is an infectious disease which is caused by the HBV or the hepatitis B virus. It affects the liver. The virus attacks the liver cells and leads to liver failure. It can cause both acute and chronic infections. In acute infections, people show certain symptoms like dark urine, sickness with vomiting, abdominal pain, yellowish skin, and etc. Most of the chronic diseases do not have any symptoms, but still there is chance for the cirrhosis or liver cancer to develop. Virus is transmitted by the exposure to the blood and body fluids. Risky factors include dialysis, blood transfusions, and intravenous drug use. For the detection of the virus, there are certain tests called assays which involve certain blood tests to detect either the presence of the viral antigens or the antibodies produced by the host. Children and infants are most likely to get chronic HB infection. Though some adults show certain signs and severe symptoms, still they have a chance to get recovery. If you feel that you are infected with this virus, it is better to take certain precautions which can prevent the spread of this virus to others. The infection control precaution for this virus is of 2 types, that is the universal precaution and the blood and body fluids precaution. This virus is preventable since 1982 by a vaccine. Though the virus is preventable and then it is better to keep yourselves away from this virus, that is getting acquired to this virus, by taking certain preventive measures, and prevention is always better than cureness.
Hepatitis C. Hepatitis C is a blood-borne disease. It is caused due to the usage of contaminated blood, contaminated injections, and sexual transmission. There is no vaccine for hepatitis C. The affected mother may pass it to her baby. The affected person will develop liver cancer. Consumption of alcohol and smoking leads to hepatitis C. Symptoms are fever, jaundice, abdominal pain, joint pains, and etc.
is an infection that causes the liver to become inflamed. This swelling can impair liver functions and cause long-term liver problems including liver scarring and cancer. The symptoms of hepatitis D include yellowing of the skin and eyes, which is called jaundice, abdominal pain, joint pain and vomiting. It can be spread through the direct contact with the body fluids of an infected person and having blood-to-blood contact, sharing needles during childbirth, etc. A vaccine against hepatitis B is the only method to prevent HBV infection. And hepatitis D also transmit through urine, semen, blood and vaginal fluids.
Hepatitis E virus is a global emerging virus that spreads through contaminated drinking water and food materials. Its symptoms include jaundice, lack of appetite, and nausea. In rare cases, it can lead to acute liver failure, requires medical diagnosis and lab test. It is a short-term disease that resolves within days to weeks. Treatment focuses on supportive care, dehydration, and rest. Can be prevented by avoiding raw meat, contaminated water and by washing hands frequently.
Do you know how this disease have affected the world's population? So let's see to it. Hepatitis A. Hepatitis A, about 7,134 people died in 2016. Globally, about 1.4 million cases every year. Hepatitis B. About one-third of the population were affected by this disease. 391 million people, that is cases, due to the chronic hepatitis B virus, and 145 million cases of acute HBV infection. 750,000 people of hepatitis each year. Hepatitis C. Approximately 1.75 million people were infected with this disease, that is hepatitis C. 5 lakh people die each year. Hepatitis D. Hepatitis D had infected 5% of the people who were affected with hepatitis B virus. Hepatitis E. Every year they had about 20 million cases. 56,000 people died due to hepatitis E.
Precautions of hepatitis. Avoid having contaminated injections. There are vaccines for hepatitis A and B, but there are no vaccines for hepatitis C and D. Vaccine for hepatitis A is Hervax and vaccine for hepatitis B is that of Comvax. Take care while taking injections because there are chances of transmission of hepatitis. People affected with HIV have more chance of being a hepatitis patient. Take care while taking boiled water because it's a safety which ensures you protection from HIV.
So actually now we know what is hepatitis and the different types of hepatitis. Hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. So trying to surviving in a body where you yourself is trying to give up, it isn't easy to survive when you yourself are destructing from inside. So in this type of situation, it occurs that you yourself try to give up. So to get out of this situation, there is only two ways, either by medically or emotionally. Emotionally means either you just give up or you try so hard to get or to not give up in this situation and try so hard to fight. So I would like to thank everyone, all the students who have done this project, and I would also like to thank our dear teachers and our beloved principal ma'am.